constipation in children is a very common problem. A constipated child has infrequent bowel movements or a hard, dry stool. Constipation. So Jennifer, what are the ways that, I guess at this point, how do you treat it if you know the child's constipated? There's a million over-the-counter things that you can do, but how should you treat it?
Well, the first step in constipation is really being aware. And many times we have patients and families who come into the hospital and they come in with complaints of abdominal pain, and we do ask them in their history, does your child suffer from constipation? And unfortunately, a lot of the parents most of the time will say, oh, no, they go to the bathroom every day. And then we further ask them, when they go to the bathroom, is your bowel movement, is it hard? How many times do you go a week? Is it soft? Is it liquid? And parents sometimes are really, A, either unaware that their child is constipated, or B, they don't recognize the signs appropriately. And then when we start working them up, we do see that, in fact, they are full of stool and very constipated, and it's sometimes surprising to the parents. So awareness is really, really important. And at different age groups, that's obviously, in toddlers, parents are more aware of their children's bowel habits versus once they start becoming older, school age, and then teenagers. Mm-hmm. So it's important that we educate the child as well as the parent on what the signs are. In terms of what do we do about constipation, prevention is really the best thing for constipation. You want to try and avoid getting to the point where you're so constipated you wind up in an emergency room. And things that you can do for prevention, diet is a very, very big factor in constipation. Increasing your fluid intake, increasing your fiber, your fresh fruits and vegetables. Activity levels are very important. You want to make sure that these kids are up and active, not sitting playing on the video games or on the computer for too long.
Good luck.
Yeah. And the other thing that's interesting with constipation is that children who go to school, the bathroom situation in school is not always the most comfortable for a child to go and spend time that you sometimes need to, take care of your body properly. So they sometimes get very busy in school. They have a lot of activities and they tend to avoid, and that can lead to problems too. So the prevention is really key for preventing an issue.